Good afternoon, folks. I'm gonna go ahead and get started. We're at the top of the hour. And I'm gonna call up board member Joshua Jordan to put this program together for us and I introduce the program.
Good afternoon, welcome to City Club. My name is Joshua Jordan, I'm a board member. I'm very, very pleased to announce today's program. It's a topic that holds dear to my heart. Today's program is going to be on the Lane Stabilization Center and Timber Springs Behavioral Health Hospital that is going to be opening out by Gateway. And our two wonderful speakers today that are going to be presenting, we have Britni D'Eliso, who's a Lane County Health and Human Services Behavioral Health Project Manager. She's been working locally in behavioral health field for over 10 years, primarily serving individuals who are navigating chronic and complex behavioral health conditions. And our other speaker is Alicia Beymer. She owns more than 25 years of varied experience serving Lane County with demonstrating records of bringing stakeholders together to improve healthcare access to all and strong patient advocacy. I'm very, very pleased to introduce you wonderful, wonderful speakers. With that being said,
thank you. I'm Alicia. This is Britni here. And I guess the cat's out of the bag. I've been doing this for a long time, 25 years or more. So, but we're really excited today to talk to you about a public-private partnership between PeaceHealth and Lane County. And really, you know, the emphasis is on increasing access to behavioral health services in our community in a really new and innovative way that, quite frankly, we don't have in the state. And, you know, I think as we look at this vision for our project, you know, it's really going to help serve our community very well and close some of the gaps that we're all experiencing. So with that, I'll turn this, I think.
Should just be the arrow.
Eric. So we've been doing this roadshow for a little while, so we're okay if we're not with slides too. But really, I think as we look at the current state in our community, and you all probably know this very well, but currently in Lane County, we know that 1 in 5 adults experience a mental illness or a mental health experience condition in their lifetime, and 1 in 6 adolescents and youth experience a mental health condition in their lifetime. And that's even before we really see what the impacts of the pandemic lead to as well. And we also know if you look at those numbers, out of the 400,000 people that live in Lane County, that means that 70,000 individuals that likely one of us knows and probably cares very deeply about has been impacted by a mental health condition in their lifetime. And so that's really the current state that we're looking at. And if you look at Lane County, compared to the rest of the state, we have the highest utilization of mental health services in the state, or one of the highest. And we also have a very high suicide rate. So those are things that we just know when we look at the landscape in our community that we do have a need here. And the project that we're talking about is really for adolescents a week who come to our emergency department, who need inpatient psychiatric, adolescent psychiatric care, who board in our emergency department for up to a week at a time, while they wait for a bed up in Portland. And so that impact not only is definitely not a trauma-informed environment for those youth and those adolescents who are waiting, and also for those parents and their loved ones as they're waiting for their child to get the care that they need. But so there's that impact, but those youth and adolescents are also having to go to Portland to taking their family out of the area for some period of time to support them while they're up there as well. So that's what we're seeing. We also are seeing adults who are having to go up to Portland for care right now, because we don't have the services that we need here in Lane County for inpatient psychiatric care. And when we look at the project that Britni is going to talk to you about, one of the things that we see that's going to be a great benefit, not only for our for patients who are presenting to our emergency department for psychiatric care, but also for our medical patients. So yesterday I was down in our emergency department. Every single bed was full of patients, and for medical needs, it's a high flu peak season right now, right? So when we look at the project that Britni is going to talk to you about, those patients can go to the behavioral health patients can go to the stabilization center and get care there rather than going to the emergency department. What that means for patients who are coming to our emergency department for medical needs, like a broken bone or for influenza or medical needs, that means that they will also have a reduced length of stay in our emergency department, because that frees up beds and nursing and doctors' time to be able to support our medical patients that are presenting there, because behavioral health patients are going to the stabilization center. So that's, and then we're also seeing, and Britni's going to talk to you about this a bit, about with interactions with law enforcement and also our mobile crisis. So we have at least 2 to 4 patients a day who are brought to our emergency department via law enforcement. And then another 3 patients who are brought in for a mobile crisis. And so those patients would go to the stabilization center as well. So for PeaceHealth's perspective, there's the arrow. I keep messing this up. So that's really what we're here to talk to you today about, is the integrated model. For PeaceHealth's portion of this, it will involve a 96-bed inpatient psychiatric hospital that will include a 24-bed adolescent psychiatric unit. So those kids will just be able to go directly into that unit, not board in an emergency department, and remain here locally for that care. And then also additional adult beds, so that, again, we can best serve adults who need that care here in our community and keep them here to connect them back out to services in our community. And then Britni's going to talk to you, and I'm not going to touch this, to you about the crisis stabilization center.
I'll stop.
Yeah. Okay. Thank you so much for that. So yeah, just to explain, a newer development in this project has really been identifying the opportunity to co-locate services. So as PeaceHealth was working to dream up how to expand their behavioral health hospital so desperately needed, the idea to have the Lane Stabilization Center, which was already a thought, to be co-located and have one-stop shopping, if you will, for higher level behavioral health care, so that individuals don't need to stop and think in the midst of a crisis, where is the right location? They can come to this property, this space, and really allow the organizations to help tease that out for them and provide the right level of care. And then we also anticipate folks moving between the 2 facilities and transporting somebody across a parking lot versus across town, especially if they're really in a heightened state or navigating something difficult, seems like much better care. So we're excited about this opportunity. You'll also see Connections Health Solutions on here. So on the county side for the Lane Stabilization Center, which I'll explain more about here in a moment, we have contracted with Connections Health Solutions. They're from out of the area. This is their first program in Oregon. But they have developed a model of care for behavioral health crisis services that's actually informed the national best standard of care. So nationally, there's a program called SAMHSA, which is Substance Abuse Mental Health Services Administration, I believe. And so SAMHSA has adopted the connections model as the best practice. So in my mind, I feel lucky that they picked us, that they want to come and operate here in Oregon and in Lane County. So we're working with them now well in advance of opening our doors so that we can have a designed program that complies with Oregon law and makes sense with the facility that we're designing to really reflect the services that they are offering. So for the stabilization center, we're talking about 24/7 access to behavioral health care. And how folks can access these services is two main ways. There will be a walk-in. Anybody can walk in, loved ones can bring somebody in, another agency can refer somebody over. The location that we're looking at is right off the bus line, really trying to consider accessibility. And it's also in close proximity to local freeways so that we can think about quick transport for our rural community members, because this is really intended to serve all of Lane County and likely a bit beyond. And then the back of the facility will have what's called a sally port, or a protected space where first responders can bring somebody in a more private and secure manner. And that space is really conducive for either mobile crisis providers, EMTs, or law enforcement to have a quick drop off. The advantage there is that our first responders get back out on the road doing the work that they are intending to do more quickly. And when I say quick, some of Connections facilities throughout the country have 10 minutes or less. You can ask Alicia, it's usually many hours when somebody needs to drop someone out of the hospital. And I actually did a ride along with EPD as they transported somebody to the county jail, and that was another 2-hour process. So we're converting 2 to 3 hours to 10 minutes to get folks back on the road, but also maybe more importantly, it gets that individual out of law enforcement custody or first responder custody into the hands of caring, trained professionals who know how to support behavioral health needs. So that's a really unique and important part of the model. We will have various levels of care that I'm going to actually describe with some photos here in a moment, but to know we'll serve all ages. So we'll have youth and adult portions of the facility. And then I just want to emphasize discharge planning. So different levels of care will either have a couple hours stay through multiple days of stay, but regardless of that level of need, the minute somebody walks in the doors, the discharge planning begins. I've heard the team from Connections joke about their name. It's cheesy, but they really are about making connections into the community, because that's the only way that they can operate successfully. They cannot house people indefinitely who need behavioral health care. They need to get them plugged into ongoing supports. And that really emphasizes more health and longevity for that individual as well. So they offer supports around discharge planning, offering transportation. If somebody has traveled here from Cottage Grove, they take the steps to find secure and safe transportation to get them back to their community where they can thrive. And they also offer something called a bridge clinic. So for folks who are aware of our current access or lack thereof to behavioral health in general, even at the outpatient level here in our community, they need to have somewhere to connect someone to. But if that appointment is 6 months out, which is common, then that individual can continue to come back to the stabilization center to receive medication refills and touch points, all while they're still preserving their appointment 6 months out for their long-term care. I think that's an important part of the model. But looking at some photos, so as I mentioned, Connections is in other states. So this is their newest facility up in Kirkland. Our facility will not look anything like this on the outside. This is in a current business park. So I show you this image, because it's in the Northwest, so it's kind of comparable to us, but also to demonstrate that these facilities can function really in any sort of context and environment. And so this is their front entrance within there, and it's much larger facility than we're needing to build here. So one level of care is really comparable to physical health urgent care. So walk in, no appointment needed, 24/7, any age. They have a metric that they meet where you are able to see a psychiatric provider if needed within 90 minutes of walking in the doors. Again, psychiatric appointments are typically many, many months out if you're just trying to schedule that on their own. And it's from this urgent care reception area. These photos are all from that Kirkland facility that folks will get plugged in either to more intensive care at the stabilization center or possibly up to a community-based resource. Folks will access peer support specialists here, as well as case managers, therapists, and psychiatrists, and some medical parents. 23-hour observation is kind of a weird clinical term that they use. So in layman's terms, this is referring to a section of their program that allows folks to come and hang out in a recliner. You'll notice all the recliners are in one room, and that's actually attributed to something called milieu therapy that has a lot of research around the benefit of being near other people who are navigating similar sorts of situations to help improve your treatment and your recovery process. So this space is an area where folks can stay for up to 23 hours and 59 minutes, which is a licensure requirement. But they have found that really with very frequent access to the right level of providers, often that's what most people need. It's 24 hours or less of immediate care and the right care. And it's kind of amazing what that does. So they can access a whole care team of providers in this environment. This space is for adults only, and I'll explain a little bit more actually now around what we'll offer for youth. So we don't have a photo of this, but in addition to this open room concept, there will be 2 more units, one for adults and one for youth that have individual beds, more standard to what you might see in a residential or hospital type setting. And those bedded units are where folks can stay for multiple days if needed, because a lot of times a complex crisis situation requires a bit more discharge planning, stabilization, maybe trying out a medication and needing a few days of support. An advantage that we have over the hospital setting, because these are 2 different intensive purposes, is that we will not have as stringent of kind of cutoff discharge timelines that are based so strongly on medical criteria. So if somebody needs another day just to fully kind of get their discharge plan in place, we'll have more flexibility to be able to do that based on how we're licensed. And then for youth services, any youth that needs ongoing care outside of that urgent care setting would go into the youth individual rooms bedded unit, and that allows for treating a broad range of needs. You know, a 7-year-old and 17-year-old are going to have quite different needs, and then also youth typically are accompanied by caregivers, so we want to have space for the whole family to be supported. And youth can stay for multiple days, so 23 hours if they need. I wanted to show, this is what they call a calm room. So this is just off of that main open concept space. And so if somebody needs a minute of privacy, if the milieu therapy is not what they need right at that moment, they can take some time here. They have textured walls in case somebody needs to kind of fidget. They have adjustable lighting. Not only is this just a really beautiful space, but I want to highlight, we have already done extensive outreach to community members to gain feedback on what Lane County residents want this facility and program to look like. And we've captured that and then have another round of that coming on. So these are the type of spaces that are less restricted by licensure requirements, where we can flavor this of like, here's what a Springfield resident has access to, which might be adjustable lighting or different white noise options. There's some room for this to actually reflect our community need and preference. And then lastly, I'm showing you the staff lounge just to be a kind of a talking point for myself around workforce development. If folks are kind of tuned in, behavioral health workforce is in dire state right now, like many of our different industries. And so we are using this on-ramp. We have about 2 to 3 years before this facility will open to do really intensive workforce development strategies. We have a planning session next week where we're bringing universities and other institutions together with behavioral health providers to think about not only pipeline development, kind of talking to high school, college age students around this profession, but also retention. How do we recruit folks that can actually stay longer than 2 to 3 years without getting burnt out? So that's a big part. That's a big barrier that we're trying to navigate, because these 2 facilities, between the 2, it would be like 300-ish new behavioral health employees, which is exciting from a business perspective and tricky and complicated from a current pools perspective.
I think I've talked about this a bit. I would just say, in addition to the workforce, as we look at the healthcare workforce, especially the behavioral healthcare workforce, and those that work in our emergency department, one of the great things about this model is we do see heavy burnout from our healthcare workforce because of moral distress, and that involves not having a place for our patients to go, and they're seeing the same patients over and over again, and not having a place for them to go to get that help. We having youth or adolescents that are boarding in our emergency department for we've had up to 30 days at a time because there's no place for them to go, and they're in a windowless emergency department room. That is a big burnout issue for our healthcare workforce, and this is one of those ways that we can help inspire and keep them engaged and give them hope. And so that's one of the great benefits of this program as well. So I did touch on our inpatient behavioral health model of care with we'll have the adolescent psych, which we don't have in this area. It will be open for all of those adolescent psych beds that we have. It will be a regional referral center, so we may have patients that are coming from out of area into those beds. And because we're adding additional, currently our 35 bed unit, which is currently located at University District, we will close that unit upon opening this unit, but it will add another 35 adult beds. So there is possibility that we'll have additional patients coming from out of the area. I do want to reassure the community that just like Britni talked about for the Lane Stabilization Center, we work on very robust plans, which include transportation and a very robust discharge plan for those individuals, so that when they're leaving our facility, we are making sure that they're going either back home or back to another type of care facility. And there is sometimes fear about the population that we serve in these facilities. I will assure you that currently our behavioral health unit is located on the University District campus, and even just as I was down there, we have college students who literally walk on their cell phone within feet of that building and don't even know it's there. So that is our intent. We are very good neighbors, and we will continue to do that in this setting as well, and also have robust security programs and plans in collaboration with law enforcement. We will also offer substance dependency beds, which will be for patients who have both a psychiatric diagnosis as well as a substance use disorder. And we actually do that right now, but not to the extent that we'll be able to do in this new facility. And this is an outside rendering of what our proposed building will look like. So next steps, this is, it's a great opportunity and gift to be able to collaborate with Lane County and work on really providing this campus model of care. But with that, there's also a number of complexities just with any new projects. So we have a number of complexities and what we call milestones, because we really want to just keep celebrating them as we go through them. The first milestone, and we just can't say enough appreciation to receiving unanimous approval from the Lane County Commissioners. That was a big deal, and just having them behind us is great. And then we have a number of other milestones, including purchasing the property. There's some complexities there given the location. Zoning will be a milestone that we look forward to achieving. And also from a inpatient psychiatric hospital, we have to go through a certificate of need process, which is fairly complex. And that takes about a year. The county will do a design for the stabilization center in that year. So we'll almost be aligning together about when we will be opening, which is about a 3-year process. And then what Britni alluded to is really our focus right now is looking at developing and building a robust behavioral workforce. So yeah, I had the opportunity to tour both of these facilities. One that we're designing these facilities off of. And I'll just say that I walked away from both of those tours with an overwhelming sense of hope that we will be bringing to this community, and what a great gift that we will be bringing. Thank you. I think we'll open it up to questions.
Thank you so much, both of you, for coming today, speaking about this big project for our area. Britni, you mentioned for the Lane County portion, that you've already identified the operator, and Lane County then would be the owner of the facility. What does that funding model look like? Are you responsible then for the capital project portion, or will you be responsible?
Yeah, thank you. So the question is around funding. Since we are contracting services out to another provider, what responsibility does Lane County have for funding? So we are definitely fundraising, and the county will be responsible to fund the full capital. We will own the building when it's done. The most recent estimate, which I was just sharing over lunch, was given to us about 2 years ago, so it's certainly increased since then, but we're looking at about $30 million to build maybe roughly actually 30,000 square foot facility. So Lane County's on the hook, if you will, for that. We have secured about 17 million so far, and that has been through county contribution, state and federal grant funding. And we have some strategies in place to try to close that gap. Operational, this will be primarily funded through billing insurance. We will be serving anyone and everyone, including those who are uninsured. The county does have some indigent funds to be able to support uninsured individuals. But I have to point out, and I know Alicia will reiterate this, currently when we look at Medicaid rates, which is the majority of folks we anticipate serving just based on statistics, reimbursement rates are not sufficient for services. And then looking at Medicare and commercial, Medicare and most commercial plans don't actually cover behavioral health crisis services at all. There's been movement happening nationally around parity to encourage the behavioral health system to be able to match what we see in the medical system as far as reimbursement and coverage. And that's been a decades-long conversation that's maybe making some steps forward, and new programs like this can certainly help reinforce that need. So at the last, again, this is probably 2 years old or so, but the last estimate we had is about a $5 million gap annually that will not be covered by insurance reimbursement. And so we are trying to problem solve that right now. That would by default essentially fall to the county. General fund's not going to cover that annually. And so we're getting strategic, wondering about opioid dollars for those familiar with that funding, seeing where we can get creative. But I've had commitment from my leadership that we will not break ground until we have an answer to that question, because we're not interested in building a facility that closes 3 years later due to operational failure.
Yeah, and I'll add just for clarity for the inpatient psychiatric hospital. So this is a joint venture partnership with LifePoint, and so bringing in their expertise for operating and running this very complex service. They will be also operating that, and then they're also helping bring in the support for the capital for the building. We actually are excited. Next month, we're going to be breaking ground on an inpatient rehab hospital off of International Way, and that's for physical rehab, and that's a 42-bed unit that we're looking at extending to 50 beds, but that is also a joint venture partnership with LifePoint as well. And as far as the reimbursement goes, again, there's a lot of advocacy. That's one of the milestones that is on our list as well as to achieve, is to make sure that we're receiving the funding that's going to cover the cost. Behavioral health services has never been something that, has made money. Most of the time we run at a loss. We recognize that by actually offsetting other services that can cover those costs, because we know just how important it is, but we do need to at least break even and be able to cover those costs. So that's what we're working on.
So, 3 questions, and I have a whole bunch more, but I think some of them are easy. So going back to the 23-hour, is that adolescent and adult?
Yeah, the 23-hour unit is just adult. So the state has a lot of really valid rules around the separation between youth and adult that we'll be adhering to.
Yeah, that makes sense. Will you be paying property taxes? Okay. And then the last one, what about, kind of, what do you, first of all, I love everything about this. What about NAMI and how are they involved with you?
Yeah, the role of NAMI. So we have a quarterly kind of community-wide steering committee that has representatives from other behavioral health providers, from law enforcement, from cities, CCOs, and community members. So NAMI is represented in that space. And they're on our short list when we need to call and get counsel on how to message something that's really being mindful of the folks that might be utilizing services. So I would call them an advisor and then a support, and they participated in that quarterly steering committee.
What kind of zoning changes you need for this project?
Yeah. It's currently zoned as campus industrial, so we'll have to rezone that to commercial medical.
Is that a big?
It is.
deal?
Well, yeah, I mean, we went through it with our inpatient rehab hospital, and that zoning process went uncontested, so our hope is that the same would occur with this project. But we recognize there's concern about especially the patient population that's served here, so really our goal is to collaborate with the community and the neighborhood so that we can bring them on board and engage them and feel comfortable about it and support the zoning. That's our hope.
We have a question from Zoom. Erin, would you go ahead?
Everyone, hey, this is Erin from Springfield Municipal Court. I just want to say I've been a part of the planning for this facility for the better part of 5 years, I feel. Britni and Alicia have really taken it on and sorry, my thing muted. To build this facility that our community most just really needs, and it's gonna have a great impact on the justice involved population as well. So I'm really glad that you're spreading the word to other Springfield community members to build awareness about what this facility could really do for our community. It's not really a question, it's just a statement.
We appreciate your engagement.
I have a question. So I recently learned a couple months ago about the new behavioral health report that they're having at Lane County. Are you guys gonna work in partnership with that court system to collaborate on care for individuals?
And at the new mental health court at the county level.
Yeah, well, it's not mental health court, there's like a behavioral health court that's on Friday, I think, yeah.
Yeah, I mean, I sit on that advisory committee and others. I mean, I just can't emphasize one of the great things about Lane County, and I collaborate with a lot of colleagues around the state, is that we do a really great job collaborating with other providers. And so our intent is completely to collaborate, and our goal is the individuals that are engaged in that behavioral health court, if they're coming to our services, that we're helping to support them and get them any services that they need.
I'll just add to that too, that so we have Lane County District Attorney, multiple judges from the Municipal Court, Aaron Selby, the Springfield Municipal Court, are all in really active participation around planning, so that we're considering the role of corrections in the criminal justice system as forming work plans and.
To what extent do the capital aspects of either of these projects rely on federal funding? And are you concerned about the availability of federal funds?
For our portion, it's not reliant on federal funding as far as the capital. Of course, the reimbursement, because our payer mix right now is about 78% government payers. So that's, Medicaid primarily and then Medicare. That definitely is something we're watching very closely, and advocating, quite frankly, we've been advocating for the last year or so at that reimbursement to be able to cover the cost of care. So we'll watch that.
And to speak to the capital, so off the top of my head, we have 2 federal grants and one state grant that all collectively probably about 8 million of the 17 million we have secured so far. And all I can really say is that a lot of functions and aspects of county business are dependent on federal dollars. So we've got a whole crew of folks assigned to monitoring the daily changes. And we're kind of holding that space with you all as community members. One advantage we have with, in regard to operations and what Alicia's speaking to is the fact that Connections is really active, at the federal level around, legislation. And because they have facilities kind of speckled throughout the country, they have a unique lens and pulse on what's happening and what worked well here versus here. So we're relying on for that as well.
Alicia, I know, you. PeaceHealth has really kind of hit the streets and talked to a lot of the business owners in that area with regards to the rezoning. It's a little bit of a change in vision for that whole area. What have been your conversations around your vision and your work with those industrial employers who are in that space for what you see the future of the Gateway area?
That's a tough question. Yeah, you know, I think what I can say is when we looked at the property, you know, we looked at that property because we are seeing that what's being built on International Way, for example, has been primarily medical, or has gone in the last couple of years even. We're opening the inpatient rehab facility, and that went in through the zoning uncontested. So in looking at that property, we felt like that also would be supported with that property, with the property we're purchasing for this project, because we are seeing what's going in on that lane area has been medical. So, and those have been the discussions that we've talked to with the neighbors, and I think mostly, you know, understandably, the concern is about safety and the population that's served, and so really wanting to help people understand what the programs will offer and how we will be providing a safe environment. Eve Gray from the county always says this very well, is that, you know, we have to provide a very safe environment because 300 staff are going to be going into these facilities, and we want to make sure that they feel safe and that they are safe when they go to these buildings to work. And so that is our number one goal, is being able to provide a very safe environment. I oversee security services, and we're very proud of the program that we have. We have a very, very robust security program that we intend to continue to model over in these buildings as well. Yeah, and then one of the other things we talked about is bringing in Springfield Police. So I have University District, and you know, especially in 2020 when we were seeing a lot of protests being down on that campus, that was quite frankly shutting our emergency department down. PeaceHealth started convening meetings with Bushnell, U of O, Eugene Police, and local law enforcement quarterly, kind of like a neighborhood watch, where we would really get together, talk about safety issues, how we can collaborate, and really help make our neighborhood safer. So the goal with International Way is to also model something like that. And we can start that now, and we should, especially as we've got the Riverbend Annex, which is on International Way, which also includes home health, hospice is in that building, and our lab services are in that building. And then with the inpatient rehab hospital, it's a good time for us to start those types of conversations.
And if I'm not mistaken, did you not both say that discharge planning includes assuring that anyone who leaves the facility has some place to go other than the sidewalk.
Yes, we both did, and that's a big commitment of ours. And I think there's opportunity for us to look innovatively on how we can do that and support the community. Yeah.
Do you feel like there's enough systems in place currently that if you were to stand this up tomorrow, you have somewhere to send everyone, or are there some other things that the community is working on?
So, yeah, I can answer that from the emergency department perspective, because we are currently and serving this population at Riverbend, which is in that neighborhood right now, right? We don't, the challenge with an emergency department is if Britni comes in for service right today for a behavioral health need, if Britni came in today, we will do a medical screening exam, which involves a physician seeing Britni, screening, talking to her, and if she's stable, then our social workers will give Britni a card and some outpatient support, and Britni will leave. And oftentimes, depending on how she arrived, either she's coming in with a vehicle, walked in, or rode the bus, Britni leaves with a card and not really a touch base on services outpatient. So the Crisis Stabilization Center, if we stood this up tomorrow, the benefit of it is that Britni would stay, and she would stay there until they actually connected Britni to whatever service is available in the community. And we have those services today. We have Lane County Behavioral Health is a very good service. That's why we're partnering with them. They're available to support patients. Looking Glass has great youth and adolescent services that if you can do that warm handoff and arrange for them either to come to the stabilization center and see her, or for them to call and make sure that gets connected during the times that they're open, that will help them to be more successful. We have a lot of different services in our community. It's just being able to help that person access them. And an emergency department is not currently the way that we can do that. But if we did open the stabilization center tomorrow, we would definitely be able to do that much better, and especially under Connections leadership.
We'll add to that, we do desperately need more behavioral health, mental health, and substance use at residential facilities and beds. Right now, somebody that would require residential support for their mental health need, it's statewide, and they'll get sent to Hermiston or the coast or really anywhere that there is. And we also are all aware likely of the reality of our state hospital, which runs into a similar snag. So yes, and the stabilization center will certainly have folks that come in that need residential ongoing level of care for many months. That's not the purpose of the stabilization center. There are parallel efforts happening to our project to get increased funding. One of the biggest barriers is finding willing providers. It's not a really lucrative industry, and it's difficult work. So there's been state funding that's been offered, startup funds and additional bonuses and that sort of thing to open additional beds, but it's been finding those providers. So that's a community need that hopefully we'll get some traction in the next 2 to 3 years, but it will probably be an ongoing need.
So kind of a combination of things. This is going to show how dated I am in terms of some of this information, but I'm thinking, are your intakes basically going to be voluntary? Or are you also going to be dealing with involuntary? And remind me, because back in the day, we had 72 hours. And that was thrown out, and I'm not sure where we're at in terms of how long you can hold somebody.
Five judicial days.
You can 5 judicial days? Really?
In regards to if the stabilization center services will be voluntary or involuntary, it's fair to have that question because that's been we've had that conversation that lasted for a good couple of years because there's a lot of valid, strong feelings about that, and it's putting people's rights and dignity into question as well as safety and how do you choose one over the other. So it's messy and complicated. That's said that we are adhering to the connections model. Again, that's been endorsed at a national level, and it does include an involuntary component. And really the thought there is if somebody's requiring that level of support and care, it will either happen in the emergency room, in the hospital setting, or in the jail. So why not provide it in a trauma-informed setting with behavioral health professionals? And Connections has really significant statistics around what they describe as converting somebody from involuntary to voluntary. I want to say it's close to 70% of folks that come in on an involuntary basis are quickly converted to voluntary because once again, they're receiving the right level of care immediately in a calm, trauma-informed environment that de-escalates the situation. And then they can actually be in a state of mind where they can choose to opt in to continue receiving care.
So along with that, you know, the drugs today, including marijuana, are so much more potent and powerful and deadly. So are you going to be able to handle kind of the drug detox to cleanse out the system so that the involuntary becomes more voluntary?
Yeah, so the role of our care in regard to folks who need to detox will be really closely partnered with the Lane family and definitely utilizing their Buckley detox facility, which if you haven't heard is expanding, not only in number of beds, but also in their staffing and their programs around serving folks with medical complexities, which is really common for folks that are navigating substance use. So we would receive somebody, we will have medical folks on staff to provide that immediate care, but we will have a very common back and forth phone line with William family to support detox and also have the co-located hospital with the specialty services available for substance dependence. So.
Yeah, and then the nice thing is it's just, you know, right, really close to Riverbend, so if they do need that higher level of medical care, they can go over there. If that's needed. It's a great question.
Oh, good. So this is really gonna go back, and I think this went away, but you know, when I was involved working in California, we had the category, because you talked about safety. And we had the category of mentally disordered sex offender. We actually had a hospital at Tascadero. Frightening place accident from my perspective. But anyway, you know, we 5,000 people in this facility. It was huge, and of course, it's California. We don't have any category like that. And how do we kind of protect again? You know, but you have your different categories, you know, drug abuse, mental health, and then you've got these other issues which are really threatened.
Yeah. So, I mean, what I can say is we do that every single day in our inpatient behavioral health unit. And so part of that is really screening the patients, closely looking at what their history and backgrounds are and what potential risks they may bring to either our staff or other patients. And then identifying what those are and if, and then either adding additional security officers if there's a propensity of violence or they have a history of violence or sex offense. And adding those additional support networks in to make sure that other patients and our staff are safe, as well as making sure that person, that individual gets the care that they need. So it's that balance. We do that every day and we do it very well. That's our commitment when we open the facility.
I think one last question. Alicia, you mentioned working with OHA on some regulatory work. We're in session right now. Is there anything we should keep an eye out on that we're working on during the session related to the project?
Yeah, we actually on Tuesday, we have a pretty big hearing at Senate Bill 140. That's really about access of care for a population that we serve, the civilly committed patients primarily, and that's related to patients that you know have when there really is a really limited access to services right now for that population. So we're going to be advocating strongly for our civilly committed individuals in this state. And again, that will involve both the stabilization center and our facility, because if we can't help our civilly committed patients access care in a timely manner, then they're languishing in our unit for months, sometimes up to a year at a time, because there's nowhere for them to go. And so we're really trying to advocate strongly for that population. And then there's also advocacy on multiple different levels for reimbursement. And that parity that Britni talked about for psych behavioral health reimbursement, and both inpatient and outpatient. And then also, there's quite a few different bills out there that we're looking at and advocating strongly for. But any support, we also are going to be doing we've got a website that's coming up that's gonna be both Lane County and PeaceHealth that we'll be sending out, I think, in the next week or so, right?
Yeah, we have, what you'll see, just to clarify, what you see up here, so the Stabilization Center already has its own website where there's a lot of background information about this project and a chance to sign up for newsletters. And then coming soon, probably in a week or so, not only will we have a landing page website that highlights this partnership with PeaceHealth, but we'll also actually have a media campaign that rolls out that will have billboards and media presence. And the goal there is really to continue a message of destigmatizing behavioral health, of grounding ourselves in the reality that we all either personally or have a loved one that's been touched by a behavioral health need. And then setting the framework then for community-wide messaging more specifically about these projects. So not what you had asked about, but important for you all to be championing this work within especially the Springfield community, and that's a good place to stay plugged in. And then also just speaking to the session, Representative Lively actually has championed the ask around securing additional capital funding for the Stabilization Center. So our appreciation to him and the folks that voted him into his place so that he could do that. And then also just to know that that's another one to watch.
Yeah, and what will be attached to this website is also an opportunity for you to write your legislators in support of it. So the more we can get out there, that will help with the project and the entirety. I know some of you have already written letters, so thank you. And yeah, we appreciate it. And please don't hesitate, Britni and I love the questions, and keep reaching out to us. We look forward to talking to you more.
Thank you both again for coming. So City Club programming for the next couple of months, we do have February 20th. Lee over here and her partners over at SAFE are going to have a presentation for us, and then March 6th we'll have Chick-fil-A here. We're still eating pizza, but we'll have Chick-fil-A new franchise ownership. Speak about their experience. Opening a new franchise and the economic development project and all the jobs that are coming with that. And then March 20th, we did reschedule this because we had to get the accident. We got exposure from Lane to speak about their work on their prairie restoration and fire restoration. To see you at some of our upcoming programs, keep an eye on your newsletters, and thank you all for coming.